Today, Brad, we're going to talk about the big lie that there is about the bulging discs and about herniated discs.
Right, it's a big misconception and we need to clear it up.
That's right.
Bob and Brad, the two most famous physical therapists on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
All right,
Bob.
Brad, today we're going to be talking about actually the big lie, which actually comes in part from this book called Paindemic. And this was written by Dr. Melissa Katy. She's a doctor of osteopathy.
Sure.
And she wrote a chapter in this book called The Disc,
Sure.
I believe it is. And that chapter alone might be worthwhile getting this book, Brad.
Right, it's a
Man.
good chapter, and if you got back pain and you're thinking about getting an MRI, you really should read the
Right,
information.
MRI, or if you're thinking about having surgery,
Sure,
you definitely
yep.
want to. So we'll talk more about this book in future videos.
Sure.
But right now, let's talk about the big lie. All right, first off, let's say you're having back pain. You go in and you have an MRI, and they found out you have a bulging disc or a herniated disc.
Sure.
And you're going, oh my God.
Right, you're all excited,
You're
but
excited.
I better get surgery.
I better have surgery.
Right.
And the thing is, that's probably the last thing you want to do, because the problem is, what you'll find out in this study, we're going to show a couple studies, that most people some people at a certain age have a bulging disc and they have no pain at all.
Right, exactly.
So the fact, let's go right to this chart,
Sure,
Brad,
I think it's a
first
good
off,
idea,
and
Bob.
then we'll show this.
All right.
Okay. So if you have a bulging disc, what they did is they did MRIs on people. Can you see this, Lonnie? They did MRIs on people who were having no symptoms whatsoever.
Right.
They had no signs or symptoms of pain, right?
Yep.
And they did it on people in their 20s, 30s, 40s, 50s, 60s, and 70s. What they found out is that 30% of the people in their 20s had a bulging disc,
No symptoms.
no symptoms.
Active people.
Yeah, 40% in their 30s, no symptoms, had a bulging disc.
Right.
All the way up to when you're in your 70s, 77% of the people had a bulging disc,
Right.
but no pain.
And you can see it just gradually goes up with
Yep.
age.
So it's a part of aging. It's a
Right.
deterioration process.
It's like getting gray hair.
It's like getting gray hair, exactly. Or putting on a few extra pounds.
Sure.
maybe. So are you going to have surgery when you get gray hair, Brad?
No.
Okay. The other thing is, and we don't have a chart for this one, was for disc protrusions, which is really a disc herniation. We're going to show this on the model in a little bit. But on the disc herniation, the same was true, Brad. At age 20, 29% of the people had a disc herniation and had no symptoms.
Sure.
All the way up to 70, I'm sorry, they had one for 80 years old.
Right.
All the way up to people in their 80s, 43% had a disc protrusion or herniation and no pain.
Right.
So,
So if you think about it, you've got back pain, and you may have had that herniation in your disc for 10 or 15 years prior without any symptoms, and you get back pain, and it may be from a different cause.
Right.
You get an MRI, they see the herniation or the protrusion and point the finger at that. You have the surgery, get it taken care of, and you still
have the pain
pain.
because it wasn't from the herniation.
Right.
So we'll talk a little more about that, but right now Brad's going to show what a bulging disc would be like. First off, you have the disc itself, right?
Right. Well, let's look over at our Napoleon here.
Bonaparte.
We're going to look at L5 and L4, two lower vertebrae. This red bulge here represents a bulging disc or herniated disc. And now if we look at these two vertebrae, and we're going to take it out and show a model of those. This cup represents one of the vertebra. This is the other. The green ball represents
The actual disc itself.
right. So this is a healthy disc here. It moves, it has some mobility in it so that you can move your spine as we all do. But if you get a bulge, just kind of zoom in here, Lonnie, and see how we're, right where my finger's pointing, right there's a bulge starting, okay? And particularly if it's in the back where most bulges are, when you bend forward, it oftentimes makes it worse. Or when you lift weights with poor body mechanics and seated with poor posture, and that bulge can eventually, boom, turn into a herniation.
And herniation is when some of the inner material of the disc actually spills out back
Right.
behind there.
A disc is just like this. You can see there's material in there that's liquid, kind of a thicker liquid, but it can come out and cause that bulge, and that's a problem that you do not want to have.
Well, it's a problem that is not really a problem unless it pushes out the back and hits a nerve, Brad.
Right, exactly.
Yeah.
I guess what I
So,
meant to say was
yeah.
when it gets this far out and it's extreme and creating pain and whatnot.
So when should you have surgery? There are times you should.
Right.
One is if this bulge or herniation is pushing against your spinal cord, which is running right down this hole
Right.
here. The other one is if it's hitting one of the nerves coming off on the sides. If it hits that nerve, it would actually could give you some pain down your leg. And if it's causing you foot drop, Brad, where you actually started getting weakness in the foot,
Sure.
that's usually a sign that you're getting pressure on the nerve and it's going on to the,
Right.
it's pushing on the nerve itself. The other time, so really 3 instances. One is it pushing on your spinal cord. And it'll tell on the MRI, you'll be able to see that.
Yep.
2, is it pushing on one of the spinal nerves?
Right.
Or 3, is there an actual mass there? I mean, if you have cancer or some type of mass growing.
Right. Sometimes
Yeah.
it's benign and they get in there and remove it and it takes care of the problem very quickly.
Right. Or a blood clot. There could be even a blood clot
Sure.
growing on the spinal
Right.
cord. Dr. Katy, she said she knew plenty of physicians and surgeons who would avoid back surgery like the plague.
Sure.
That was one of her quotes. So it's really something you want to consider, that you really want to try some aggressive physical therapy way before you try surgery.
Right.
It really probably was the last case scenario. So again, don't get distraught if you're seeing a lot of things on your x-ray as far as which is just showing general old aging, which could be
Right.
a disc protrusion or a
Right.
disc herniation.
Yeah, I think Bob meant to say MRI.
What did I say?
X-ray.
Oh, x-ray. Well, x-rays show some of that stuff too.
Sure.
All right. Thanks for watching, and make sure you subscribe if you haven't already.
Right,
Or we'll
'cause-
come out and slap you.
Oh, Bob, we're
All
not
right,
that
maybe we won't.
violent.